Hi, everyone. It's 3:30 p.m. on Wednesday, April 22nd, 2020. Thanks for joining us. This is Janet Hill with the Rock Island County Health Department. Today, we have with us Nita Ludwig, the Administrator at Rock Island County Health Department, and Ed Rivers, the Director of the Scott County Health Department. Both of them are here to give brief prepared statements and then answer your questions to the best of their abilities. We ask that you direct your questions to the person you are addressing into the chat box. And then, as always, the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Nita, please start us off with Rock Island County's numbers. Thank you.
Sure. For today, Rock Island County Health Department is reporting 21 new COVID-19 cases. And there, unfortunately, was a death reported this morning. It was a man in his 70s who had been hospitalized. And our deepest sympathies go out to this man's family at this difficult time. This brings our number of total positive cases in Rock Island County to 302 and 6 total deaths for Rock Island County. Currently, there are 22 people hospitalized at this time in Rock Island County.
In Scott County, our Department of Public Health is reporting 183 cases. I'll mention that we've noticed a discrepancy on the Iowa Department of Public Health page that has the map. When you hover over the county, today it shows 183. You click on the county, the table comes up, it says 182. It's been like that for a few days. We have reported it. I mentioned this because I noted some published 180 yesterday, some published 179. I will always default to reporting the higher number. So today we have a couple of messages we're relying on you to help us share with the community. First, recommendations haven't changed. Stay home. This disease has taken our focus in the community from mid-February until now. That's like 10 weeks of thinking about COVID-19, learning about COVID-19, responding to COVID-19 recommendations. And we know it can feel like a lot and it can feel repetitive. But continuing to repeat these public health recommendations is essential, as there are people in our community who are just now being diagnosed with COVID-19 and families grieving those in our community who have died from this illness, including 2 individuals just this week. The virus is still spreading, it's still infecting people, and it's still taking the lives of our friends and family members. Asking you to continue to stay home may sound like a big imposition, but it's necessary because it's saving lives. Asking you to go out only when it's absolutely necessary for you and your household might also sound like a big imposition, but it's saving lives. And asking you to stay more than 6 feet away from others when you must go out is saving lives as well. You remember hearing us say again and again that individuals should not gather in groups larger than 10. Now, an important part of this message is to think about who makes up your fewer than 10 group. Individuals from different households have varying levels of exposure to COVID-19, depending on how they're implementing the recommendations from public health, including social distancing. You, as one individual, may have next to no exposure to COVID-19 because you're working from home, you aren't the individual in the family who's going out for essentials, and you're spending most of your time at home. Other individuals in your group may have a higher level of exposure to COVID-19 because of their job, their interactions in public, and the types of decisions they make in implementing public health recommendations. Remember that when you're interacting with each other, you are now increasing your risk of exposure to COVID-19. You are, in essence, being exposed to every individual with whom everyone in your group has been exposed. Remember, a person can have COVID-19 and not show symptoms. The best thing you can do is avoid these types of interactions in order to keep your level of exposure to COVID-19 low. What's the bottom line? We aren't in a normal time, and we aren't going to be back to normal in the near future. Physical distancing has to be our goal, and gathering in groups is just too risky.
We also
Now we'll
want
hear
to
from
talk,
Nita.
oh, sorry, Brooke. We
Oh,
also
go
want to
ahead.
talk, we wanted to talk a little bit today about physical distancing outdoors. Warm weather is here, and it might feel like you can put COVID-19 craziness out of your mind for a while by exercising or enjoying time outdoors. And that is a great way to relieve stress and help promote well-being. However, our public health recommendations don't end as you walk outdoors. Prepare before you go visit parks or outdoor spaces near your home. Here are 3 things to prepare for. Number 1, check to see if the park you are hoping to visit is still open. All state parks and natural resources in Illinois are closed, but many, but not all, facilities in Iowa are open for day use only. Number 2, make sure you look for outdoor spaces that make it easy for you to keep your distance from others. And number 3, not all facilities, including restrooms, may be available during this time. Plan ahead and check out qctrails.org and the Iowa Department of Natural Resources websites for more information. The safest way to be active outdoors is to stick with members of your household or go solo. Stay at least 6 feet away from others and make sure to allow enough space for passing other park goers on the trails or sidewalks. This might make some open areas, trails, and paths better to use than others. Do not go into crowded areas. Do not encourage group exercise for sports teams or fitness groups. We all miss these things, but these activities increase the risk of exposure to COVID-19, and they just aren't worth it. Just because we're outdoors and possibly around others doesn't mean we can forget the important steps we are taking when we're indoors and possibly around others.
Thank you, Ed and Nita. We'll now go to the questions. Please type any in that you have, and we will read them aloud and direct it to either Ed and Nita, depending on who it's for. First question, how do you impress upon the people the dangers and the need for caution when they keep saying that they don't know anyone who is ill or has died from coronavirus? The question is for both. Ed, do you want to start with that question?
You know, it's difficult to convince some people of the danger that many things present. People still smoke. People still drive after drinking. That's why we continue to repeat it, perhaps to the point of annoyance, that you need to stay home as much as possible, go out for essential trips only, and maintain social distancing. I'm afraid that unfortunately some of the people who maintain they don't know anyone who is ill or who has died from coronavirus may be the first that they know.
Nita, would you like to add to that as well?
Sure. I would just impress upon those that, we are reporting these numbers. They have been going up every day. There have been deaths, and, the virus is still out there, and that should convince you. There have been cases with children under 10, and there have been cases, many of the deaths have been older adults that are very vulnerable. So if you think about the older folks in your life, you want to make sure that you protect them by doing those same social distancing precautions and washing your hands and wearing a face covering.
Okay, we'll give it about 30 seconds to see if there's any additional questions, and then we'll conclude the call. We have one additional question. Have you identified any clusters? Would you like to start with that, Nita?
Sure. Neither the Rock Island County Health Department or the Illinois Department of Public Health publicly identify facilities at this time, but Rock Island County Health Department is working with all businesses in our county who have clusters or positive cases of COVID-19. We work together with the leadership to investigate the positive cases, identify others who may be close contacts of those cases who may need testing, and educate businesses and the individuals working there on how to protect themselves at all times.
Ed, would you like to respond for Scott County?
It's much the same with Scott County. The only information we're able to provide about positive cases is that we give at the top of the call.
A follow-up to that, I know you can't identify areas, but are you finding many cases linked in different ways? Do we have any information on that that we can provide?
We talked about contact tracing and how we interview those in the household. And if we identify another positive case within the household, then we provide them the information about self-isolation.
Nita, any other thoughts on that in terms of cases that may be linked?
I will say we certainly have cases, and there have been reports in the papers, and we are working on those as they come to us. But again, we just don't publicly identify those facilities.
Okay, as we see no additional questions, we'll go ahead and conclude for today. So we look forward to talking with you again later this week. Have a good day, everyone. Thank you.